Good evening, everybody. Welcome to our first Continuum of Care Town Hall, at least the first that I can remember. Yeah, please applaud, please. So, thank you very much for showing up today. Really appreciate having the folks in the room so that we can talk about all the work that we do. I do want to say a few thank yous before I forget them. It's really important. First off, I want to thank the Soper Reese Theater for opening up their doors so that we can be here and present to you. Today, we are going to talk a whole lot about the continuum of care, but please recognize that the continuum of care cannot exist without the lead agency of Lake County Behavioral Health, so please give a big applause to Lake County Behavioral Health. And again, not to forget, I just want to highlight two individuals who are doing amazing work in the background that you may or may not see, and the first one is Melissa Kopf, and the second one is Scott Abbott. They are the backbone of what makes the COC work, and so thank you very much to both of them, and again, thank you all for being here. My name is Bruno Sabatier. I happen to be the chair of the Continuum of Care. I am also a Board of Supervisor representing District 2, which is mostly the city of Clear Lake. This is important to me, this topic, and that is why I'm here. I want to introduce, or to let Jay introduce himself as well, my partner in this show today.
Yeah, my name is Jay Murdoch. I am the chair for the Interfaith Committee within the COC. I also happen to be the senior chaplain for Adventist Health Clear Lake. And so a lot of what I get to do is work with Bruno in this conversation. And I want to make it clear, this is a conversation. You are not attending a lecture. This is not an opportunity for you to just sit up here and watch Bruno and I do public speaking back and forth. This is an exchange of information, an exchange of questions, which is why we have passed out so many of these. Did everybody get one of these? Anybody not get one of these and needs one of these? Because this is how we're talking back to one another. It makes it very simple for you to write down what your question is. If you throw it in the air, does anybody have one that's filled out right now? Anybody? Great. Just like this, you're going to see Scott, who we just thanked a moment ago. He's going to see you, and he's going to come by and pick it up. So along the way, you may have more questions. You may need more cards. The expectation is we continue to have this conversation back and forth, back and forth. And if we want to continue the conversation, did everybody get a chance to fill out the survey as well when you came in? If you did not, very essential. Doreen would love to collect these from you at any point while we're doing this, after we're doing this, all the way through. But the hope is that we can continue to talk back and forth. Bruno will have a lot of the information that he doesn't have. This panel of guests that we have up here with us have the answers as well. And at any point, we may also figure out, I don't know the answer. I'm going to ask Bruno a question that you give to us, and the answer is, I don't know. That's a great place for us to be, because it means we're going to find out, and we'll bring you back info along the way.
Thank you, Jay. Raise your hand if you need a Q&A card, just in case you didn't grab one, so that we can make sure you get a card. There's hands being raised right now if we can help out. And again, when you walk out at the end of this town hall, please fill out the survey. We want to learn from you. We want to know what we need to do in this community to help continue to progress in our solutions for homelessness. There is an info booth out in the front. You may have missed it. You may have seen it. There's a lot of information with pamphlets and flyers. It is important to know what is happening in our community, what services are available. So please make sure to pass by the info booth and grab what you need.
All right, let's talk about what we're going to do here, Bruno, because there's a point to all of this. You weren't just invited here to sit and eat, although sitting and eating is a very good thing. We need to talk about what we're hoping to accomplish today. So, Bruno, walk us through. If there was an agenda, what is it? What's on it?
So first and foremost, we want to tell you who the Continuum of Care is. The COC works in the background. We don't personally provide services. So a lot of times we're not going to engage with the individuals. We're going to engage with funding. So we're going to talk about funding, and we're going to talk about the members that we help to provide those services. So we have providers here today who will talk to you about those services. And later on, at the end, we're most excited about this. We also have those with lived experience who have gone through these services, who will talk to you about their experience in maneuvering through the processes that we've created here through the Continuum of Care and our partners.
Love it. Okay, so let's start where we said we were going to start. Continuum of Care. Who are we, Bruno? We are a part of the Continuum of Care, but who are we? What is this thing we speak of?
So I'm going to kind of blend a couple of different questions here. Who we are different agencies and members who are interested and have a passion for helping those who are experiencing homelessness. We see it in our streets, we see it in our community, we see it in our neighborhoods, and we are together convening to figure out what are the solutions available. What is someone else doing in another community? How can we copy and paste that and bring it here into Lake County? And how can we help each other to make sure that those services are successful in being provided to the right people and doing the right things, providing the right outcomes?
Wonderful. We have t-shirts, which means we probably didn't assemble today. So there must be a history here. What's the history of the COC?
Real quick on the t-shirts, there is a QR code on the t-shirt. It will be a little awkward, but take a picture of us. The QR code will lead you to our website, which is lakecoc.org. If you go on the menu and go to become a member, then that's where we really want you to go with these QR codes. So our history, we were created through the Housing and Urban Development Department of the federal government in the 90s. They wanted to do something to deal with homelessness, and so they created this department. Through a legislative act, I don't know what the acronym is, but it's HEARTH. There was funding that was made available so that we can go ahead and start collecting funding and start doing what we needed to do within our communities. A regional Northern California continuum of care was created. I do not have the exact dates. I would be lying to you if I told you the exact dates. But in 2015, we separated from this Northern Regional COC and became our own because we felt we were not getting the services that we needed here in Lake County. Since 2015, it has been a slow and steady growth of who we are and how many members are part of the continuum of care to really create what you see today and what we're providing as services.
Okay, so of all the things going on in Lake County, we have lots of things that could use a little bit of extra assistance. Why did the COC choose homelessness?
Well, one is an easy answer. We're forced to because the continuum of care is part of HUD, and that is exactly what we should be focusing on. That's the data-driven answer I can give you. But the personal answer is, why not? Why are we not focusing on helping the people that are most vulnerable in our community? People who have the least to be able to prop themselves back up and get back on their feet. Why not? It is the most human thing that we can do to one another is to put out a hand and help each other out, and that's what the COC is for, and that is the inspiration that we want to give to everybody that is part of our membership and everybody that connects with us.
Wonderful. Okay, you've mentioned the people. Why not be able to look the people in the eye? One of my favorite books, if you've not seen this before, it's worthy of a read. It's a book called Until They All Have Faces. And it's the belief that if you go out and ask somebody their story, you can find a way to figure out not just what you see presented in front of you, but how they came to the point that they have and the lives that they live and they continue to live. So we talk about these people, Bruno. Who are we talking about, and how in the world did we figure out who the people are?
So just about every year, we're not forced to do it every year, but we want to do it every year to keep track. We do something that's called the pick count, and that's the point in time, where one day on the fourth Thursday of January, we go out and we count all those experiencing homelessness. This is not a choice that we say January sounds like a great month, we're not doing anything else. This is coming from HUD telling us this specifically needs to be the time frame that we do this. So every year we count. This year, I think it was January 27th, maybe 25th, we had 76 volunteers go out and start counting those experiencing homelessness, and we had 362 folks. We didn't interview every single one of them, but we do interviews where we can learn who they are and what their needs are so we can better serve them when we're done with our pick count. We did about 60 to 80 observations, I believe, and the rest were all interviews that we did. I'm giving you rough numbers off the top of my mind.
Okay, rough numbers. We're looking at 2025. What does 362 mean in comparison to years previous?
So it goes up and down. It's not a the process of the pick count doesn't come without its faults. There is no way you're going to count everybody on the same day in one day in the year. And so the count has gone up in the past. It's gone down this year in comparison to the years past. What I will say is in the state of California, we are seeing the smallest increase in comparison to the rest of the nation. So for example, the rest of the nation is seeing an increase of about 14% in homelessness. We saw a 3% increase. Now, there's a lot of reasons why that could be. We'd like to believe, because the state of California has prioritized, that we need to do something about homelessness. We have to provide services. A lot of money has been funded through agencies like the COC to be able to provide those services. We would like to believe that that is part of the reason why we're seeing that small increase in California versus other much larger states like Texas and Florida.
Okay, so it's still going up, but it's going up slower.
And I would say if you look at it in a timeline of about the last 7 years, it ebbs and flows. I don't want to say it's going up or it's going down. It might be slightly going up when you put a line from 2015 all the way to 2025.
Okay, all right. So let's drill down into some of these things. So we go around, we ask questions. What did we learn, and are there specific demographics that we can speak well of based on what we've learned in the 2025 PIT count?
Absolutely. I want to mention 3 specific demographics, and then I want to also kind of go over a couple of myths that people believe that we feel the PIT count kind of throws out the window. So first off, I want to brag that as a county, we have done a great job in trying to serve our veterans who are experiencing homelessness. We are averaging approximately 14 every single year, and what we have seen is a flat line where the number's not growing. We're not seeing it shrink, but it's not growing, and that is called functional zero. That is a goal for any COC to reach functional zero, where somehow or another, we've turned off the spigot at upstream where we're not seeing a larger population year by year, which means we are working with the programs that we are doing, and now we can try harder to try and decrease those populations. So veterans are top of mind and very much something that we are passionate about. Seniors are one of our largest concerns because seniors, most of them are going to be on fixed income, if not already soon, and those numbers are growing rapidly throughout the state, and they are showing they are growing here as well. And so we want to focus on seniors to try and make sure to give them the resources they need to not end up and be in the streets. Another one that's really concerning, and the concern is the percentages, is our Native American members here in Lake County. We, out of the 362, 45 were identified as Native American or identified themselves as Native American. That is approximately, off top of mind, 12 to 14% of the entire population we counted, when in reality they represent less than 5% of our entire community here. That is a much larger cross-section of the homeless population than the overall population, and that is of concern and something that we are trying to work really hard with our tribal partners to see how it is that we can make those change. Now for the myths. A lot of people think that we are attracting homelessness because we are providing services. When we ask people, how many years have you been in Lake County? Overall, we count the number of years. The average is 18 years. I mean, I don't know how long you have to live somewhere to say this is home, but I think 18 years should probably be enough to say this is your home, and it's not just something that you've arrived at. The other one is a lot of people, unfortunately, and I hope I'm not trying to upset anybody. Again, these are myths, that most people who are experiencing homelessness have substance abuse, substance use disorder, or mental health disorders. 1 out of 4 people, 25% in our PIC count, requested substance use disorders program. 1 in 4. 1 in 6, which is approximately 16.666666% of the PIC count identified, I'm going to flip that. 1 in 4 was mental health disorder, 1 in 6 was substance use. That throws away the entire myth that that is the picture of homelessness. It is not. It is not at all. And this is what the PIC count does for us. And the last one, it's not on the slide. Am I on the right slide? I'm on the right slide. We're doing good. We also ask if you've been impacted by a fire. We have about 24 people that still identify as being homeless because of fires as far back as the Valley Fire. And so these things impact folks that had, I don't want to say everything, but what we all aspire to have, and lost those things and are still struggling to get back on their feet.
Okay, so we know the people. We figured out where the target demographic is. The question now becomes, what is the COC doing to affect change?
So we receive money, and we'll talk about money in a little bit later. And we support the agencies that want to do good work to help out in these problems. And so we're going to highlight two agencies. I was going to say their names later, but I'll say them now. Adventist Health and RCS, Redwood Community Services, are here to speak specifically about their services. But we've been providing funding to help these shelters either prop up, continue, or completely fund those projects. I remember previous supervisor, Tina Scott, and I went to the old juvenile hall together to talk about what can we do with this empty building. Less than 6 months later, we opened Elijah House, and we've gone through multiple agencies that have been running that shelter, but that shelter has been open ever since that time. Hope Center is another good example. Adventist Health opened up Hope Center in the city of Clear Lake. Just a little caveat, the city of Clear Lake provided $500,000 to help repair the building and bring it up to snuff. So there's other agencies that are providing funding. And overall, the COC has provided some background funding as well to help them get started. Adventist Health is very self-sustainable and has been able to figure out how to run that. It's been a while since we've provided some money other than for the youth aspect of that program, but that is another way that we have continued to support shelters. I do want to highlight Project Restoration also from Adventist Health, which is helping those that are coming out of the hospitals. You can't go to the ER, get surgery, and go back to living on the streets and expect to heal. There has to be somewhere for you to go, and Project Restoration has been offering that for quite some time.
Okay, so as far as partnerships go, we've got the two that are on stage. We're not doing this alone, though, right? There's more to the puzzle. We're not just three people just doing our best to try and work through this. Are there other partners we need to be aware of?
There are many partners, and I do want to go backwards real quick. There are other shelters. I did not highlight all the shelters. Those are the ones that we work with from the COC. There are many others that we want to engage with, again, including some of the tribal leaders in this community that are opening up their own shelters. We want to support them. We want to help them be successful. We are here to be the pass-through for all the funding that we're able to receive. Partners. Couldn't do this without partners. Now, I'm going to look at the TV screen because I don't want to miss a single partner. I think it's important to get them all. First off, the County of Lake is a partner. Lake County Office of Education is a partner. Robinson Rancheria, Lake County Behavioral Health, City of Lakeport, Department of Health Services, Scotts Valley, Band of Pomo Indians, Department of Social Services, Woodland Community College, Lake County Probation, Department of Veterans Affairs. I'm on the wrong slide. There you go. And if you can change your slide, Nation's Finest, that goes back to the amount of work that we're doing with our veterans. They helped us get the HUD-VASH, which is a voucher for veterans to be able to get housing. Redwood Community Services, Supporting Bright Futures, Adventist Health Clear Lake, Sunrise Special Services, Solano Women in Medicine, North Coast Opportunities, Mendocino Center of Healthcare, Health Centers, I think I said that right, MCHC, American Red Cross, and Lake County Community Foundation. And I hope I did not miss one. If I did, I apologize, because our partnerships are what is the glue that makes us work together. So thank you to all of those partners. If we could please give them a round of applause.
Okay, let's start bringing this down to figures. We talk a lot about money, Bruno. There's money here, there's money that we use. The question is, how do we get this money?
So how do we get this money? Being the COC and doing the PIC count, we provide our data to the federal government. I want to stop and pause for a second because there's a lot of concern about what's happening at the federal government and will we continue to see the funding that we've been receiving. We have seen some cancellations. We had a technical assistance grant that got canceled as soon as President Trump walked in and started making some changes to the budget. We lost that. They were helping us to make sure that we were able to access the resources we needed. Right now, every single year for the last 2 years, we've been collecting about $50,000 from HUD. If we lose the federal funding from HUD, it is not a make or break for the COC. I need everybody to understand that we are not reliant solely on federal funds. And in the past, sometimes we got 6,000, sometimes we got 3,000. We've built it up because the better our data is, the more money we can collect, because that means we're doing our job. And so if you come to our COC meetings, you've probably heard me harping on all of our members saying, please provide your data, please clean up your data, because that's what gets us more funding. But it's only $50,000. From the state of California, we can get $1 million grants. And so we have been doing a great job, and when I say we, it is absolutely not me. It is absolutely Melissa and Scott that I named earlier have been doing a great job in collecting grants that are being made available through the state of California. And we're going to talk about how it is that we spent our money and not exactly what we spend it on, but how much.
So yeah, Bruno, let's talk about the amount of money we anticipate we're going to spend this year. Will you give us just that number?
So I'm going to put a $100 bill up on the screen. So out of $100, basically like a percentage, I'm going to tell you how much of each of the $100, out of $100, how much goes to what. So overall, we have spent about $6 million since 2018. We've collected a whole lot more, and we'll get to that. But we have spent $6 million since 2018. Now, I will give you a caveat. We have a lot of passion. We have a lot of inspiration, and we have a lot of motivation to do great work, but we're also learning how to do this work. And so what we do is never perfect, but we're always looking to do better every single year, and this year I feel we are doing better than ever. I'm getting confused of where I am. Overall, we start off with planning. Planning, we've spent out of $100, $9.20. Since 2018. So for every $100, you take $9.20, that's what's gone to planning. Planning includes some of the upgrades that we've done over in our Homelessness Haven at the old juvenile hall. We've had, I believe, $100,000 set aside so we can upgrade. We needed new washing machines. We needed some different doors because it was built as a juvenile hall. We don't want to have our shelter be a juvenile hall. So we've done a lot of upgrades and things like that, and so we have been using the planning dollars for things such as that.
Okay, keep running down this $100 bill, because for me, it's really difficult for me to understand things in like millions of dollars. Like, I don't know that I've ever seen $11 million in the same place before. So this $100 piece, it gives us at least an opportunity to break this down. So that much of it, $10 of 100-ish, is spent for planning. Where's the bulk of our money going right now?
And so just to let you know, the 10%, the 9.2, is $559,000 that we've spent on planning. The next one is emergency housing. 61.5% of all of our money, or $62 out of 100, has gone directly to emergency housing. We have been funding the entire Homelessness Haven, Elijah House, and Sunrise Enterprise, I think that's the right name, who ran our shelter over at the old juvenile hall. We've been funding the entirety of those things, plus providing some money to Adventist Health and others to make sure their programs work. That is a total of $3.7 million since 2018 that has gone directly to emergency housing.
So $61.50 of our $100 is going towards this. Will you do me a favor just so I understand this better? Because in a minute you're going to use a different term for housing. What makes it emergency housing?
Emergency housing means it's... I'm really not going to be able to dissect. I'm going to have to ask one of my colleagues. Hey, Robert. I'm going to have to ask one of my colleagues between rapid rehousing and emergency housing. Emergency housing is supposed to be overnight shelter. You need it today. Unfortunately, we're limited in beds, so we still call it emergency housing, but we're always going to be limited. Rapid rehousing is more of a caseworker type of process to get people into the right place with the right process. That's the best that I can give you. I'm going to get corrected, I'm sure, by somebody, but I thank you for the question, but not prepared for that question.
That's okay. This is what we're up here learning along the way. So take a bite out of my $100. How much are you taking out for rapid rehousing?
So for rapid rehousing, 12.3%, or $12 out of 100, is going directly to rapid rehousing. And that is, again, since 2018, $747,000 has gone to rapid rehousing.
Okay, you're running out of $100, so what else are you spending it on?
Well, first we got to make sure people know what services we're providing. We got to make sure we're going out there and finding the folks that need these services. And so 2.9%, or almost $3 out of 100, has been used for outreach alone to make sure that we are being seen and our services are known to the world out there. And that's 172,000.
Okay. There's just a tiny, you don't have much money left to spend. What else can you possibly be spending it on?
So the next one I have to explain, it's called HMIS. HMIS is the Homeless Management Information System. It's our way of tracking those that go through our services to make sure that we're referring them to the right places. We don't want to just take care of a person just like everybody's the same. We want to know who you are, what your needs are, and how we can connect you to best move you to your destination. I'm going to go back to planning. Planning also has helped pay for the software that we needed that connects to the HMIS software. On the HMIS, we've spent about $10 out of $100 since 2018, and total overall has been $600,000 for that software.
Last one.
Last one is what's needed the most, because it's hard to do anything without the folks that are in the background, and that's the administration of it. 4.2% out of all of our funding has gone to administering the programs that the COC itself, to get the funding, to push the funding to our partners and our members, and that is 4.2%, so $4.20 out of every $100, that's $256,000.
Okay, so the plan is what we're doing. How close are we to what we're projecting we're supposed to do?
So since our funding is all based on grants, we have to tell them what our anticipation of spending the dollars are. If I put out what we anticipate to spend it, that's what it looks like, and it would be a total of $11 million that we have received so far. So we still have $5 million that we have not spent, that some has been allocated, some has not. This is all subject to change. If the COC feels we need to pivot, it's possible that the state would approve our changes and that we can move more in emergency housing or more into other aspects of the work that we do. And so nothing is set in stone 100%. There's still ways to pivot, and it's based on the folks at the COC and the decisions that we make that will go ahead and decide where that funding goes.
Great. So there's still room for us to wiggle, for us to move. Let's talk about the data, because you said it's important for all of these numbers. Walk us through this slide that's here.
So I feel like I'm talking a little longer than I should, and that happens. I'm sorry. I want to highlight what I think is the most important. The number of folks that have been served when looking at our HMIS software, and this is only from 2020 to 2025, so I apologize that there's two different date frames. It's 1,378 people that we have touched, that we have attempted to help and provide services. Out of those, 575 have been permanently housed. Now, if you do the math, that's 41% of the people that we have entered into HMIS, tried to get referrals, that have been permanently housed. That is an outstanding percentage. We haven't been able to help everybody, and I don't think we're ever going to be able to do that. It takes two. We have to be able to find the right services. There's a lot of factors as to what goes into it. But the fact that 41% have found permanent housing, I think is an absolute win for the COC and its partners. In rapid rehousing, we've touched 274 folks. Out of those 274 using the rapid rehousing fund, 158 have found permanent homes, and that 158 is part of the 575.
Okay, so we've got what we're doing. Is there something that we can see just beyond here? Like, are there new projects that you'd like to talk to us about that we can see at least coming up?
Yes, two projects I want to highlight. Safe parking. We received a $1.5 million grant for encampment resolution funds. And that gives us an opportunity to create something that we don't have here. We have folks who do not want to go to our shelters, who are not ready to go to our shelters, or maybe haven't built the trust to want to go to our shelters. Maybe they have a vehicle. Maybe we can provide them something at the safe parking that would give them the right amenities to be able to stay there. So we went out for a contract we have found, we went out for proposals. We have received the proposals. We have approved the proposals, and we're working on a contract. And coming soon, we are hoping to have multiple safe parking sites around Lake County. We have set aside $400,000 in looking at what was told to me is called a Dignity bus. And what that bus is, it's been retrofitted with 20 beds so that if you do not have a vehicle and cannot go to safe parking, we will have a vehicle in there that will provide beds so that you can go ahead and use the safe parking as well. To us, that is a win. It is another step in the continuum of housing, and it's important for us to build these things because we can connect with folks at safe parking that then may get them to move into the other shelters and other aspects of housing that we have built through the COC.
Wonderful. I know you said you feel like you're...
I had one more.
One more.
I can't ignore this one because I've been looking at Kevin the whole time. We've been talking also about a housing navigation center. The city of Lakeport took that on, jumped in with both feet. They have finished their feasibility study. Unfortunately, everything costs an arm and a leg these days. So what they had was a menu of all the needs within their communities. They have already started going after the low-hanging fruit, the stuff they can afford to do, and they're working hand in hand with Lake County Behavioral Health and going out in the community and meeting with the folks that need these services rather than having the police department going out and meeting those folks that may or may not lead to services. And we know that City of Lakeport has already done some extra miles. They've been working with Lake County Family Resource Center in the past. I don't know if they still do. I haven't had that opportunity to talk. But they were doing great work before as well. So the City of Lakeport is huge in trying to be a part of the solution. The work that they've done so far, they're seeing a 50% reduction in folks that are calling in that are asking for help because of people that are homeless in the city of Lakeport. So to me, the work that they've started with behavioral health is already working, and I've asked them to please bring us your menu to the COC of the needs of the community. Let's see what the COC can do. We got to partner. We have to move forward. We can't just let the city of Lakeport take it on their own. So I just wanted to make sure and talk about that because that's an important aspect, and hoping in the future that we can have a one-stop shop housing navigation center.
Okay, dream big, Bruno. I know you said you've been talking for too long, but I want you to cast some vision. And what I'm going to do while you do this is I'm going to step aside because ultimately you've been filling out these questions for us. I'm going to go grab them so that we can, after this next piece, start digging into their questions. But will you cast vision for us? What could be further down the road if we were really doing some stuff here with the COC?
So I have in my opinion, there needs to be a housing continuum, and we just don't have that. Now, granted, we just lack housing in general, period. But we've had shelters, and we didn't have much of anything else in between. Luckily, we've been seeing some low-income housing being built, which helps and offers an opportunity. But it is difficult to go from the streets to a house. There needs to be a way to slowly get back into being housed. Safe parking is going to be a great addition to that continuum. What I'm really proud of is we have a partner, Bright Futures, I know there's another word in that and I apologize, that has created transitional housing. Transitional housing is an important part of the continuum of housing as we go ahead and help people graduate to their next steps. In my opinion, we are missing one of the most important pieces, and that's our tiny homes. We have yet to see a tiny home built here as far as a village goes. I've seen singles here and there. They don't last very long. It's passionate folks who want to help their community. But we need to work in a very concentrated way and build a tiny home village. And we are attempting to find grant funding for this. But to me, that is one of the biggest missing portions where you can really graduate from being in a shelter to a tiny home to transitional housing to low-income housing. How about we stick around for another year or two and make sure everything's okay and then let you go and be free? We want to help you through the whole process. Now, the other part is, and Jay didn't want me to talk this long, but I'm going to continue. The other part is people are still dealing with PG&E. People are still dealing with rent. People are still dealing with that one car accident that they suddenly change their finances and they can't come back, or that medical bill that they can't come back from. People are on the edge of becoming homeless. I don't want people to have to start at step 0. What if we can catch you at step 3 and get you right away in transitional housing? That is the right way to treat folks and try to have the softest landing possible so we can help you, because it is less expensive to go through this process than to have to start all over and go through it all over again.
Okay, so I've got some questions. There's 3 of them here. I want to add this too. If you are watching, I believe there's 29 people or 19 people, Megan, who are watching right now. If you are watching, we are paying attention to the chat. So if you have a question, you can send them to us. We will receive it. We can ask that question live. So I just want to make sure that's there, because we don't have anything there, but I do have a few. Okay. I'm going to ask you this question. I'm going to do this through the lens of a chaplain, okay? Because I think this is part of the reason why I get to be up here, is I get to listen to emotions and kind of extrapolate emotions all the way through. This one has a charge to it, okay? So I'm going to read it verbatim. What are we doing about the slumlords? And I think the terminology is important here, because ultimately this might be a derogatory term, but I think there's an emotional aspect to this. I think there's this feeling of oppression that comes with it, and I want to make sure we honor that feeling that comes through. But what is the COC doing in this case for practices that are, predatory towards people paying rent?
So I'm going to be honest. The COC at this moment in time is not doing anything specific about that. We put out $400,000. We haven't spent the money yet. It's out there. We're getting prepared to start using it for prevention, to help you with 1 to 3 months worth of rent or some utility bills, to keep you in your home rather than going through an eviction process. We don't want people to go through those processes. Now, what I will say is the city of Clear Lake just passed a rental inspection program to ensure that people have the homes they're supposed to be able to live in, and not substandard homes. We have been in many homes, many of you probably have been in some of those homes, that are really substandard, and we should be holding our landlords accountable. If you're going to rent, which is a business, you should have a certain level of quality that you are renting, and not something substandard that doesn't have heating, that doesn't have cooling, that doesn't have a refrigerator. These are important aspects. It should have a very set standard, and not everybody is meeting that standard. And I recognize, and I heard code enforcement, it is difficult, but we also need to make sure that people are, whether it's their homes or their yards or in their community, we impact one another. We infect one another with happiness or the opposite. And we need to make sure that we have positive neighborhoods all around, and that we have a set standard. I'm hearing you, and let's have a private conversation if you would like to, because I would love to have that private conversation about code enforcement rather than right here.
Now, ultimately, this is great, because we actually are getting engagement from the audience now, which leads to a question as well. So I'm going to interject a question into all of this, which is, if I have an opinion and I think that there's something I'd like to say, and I want to have it in a place where I feel like we're going to make some change, how do I become a member of the COC?
So you could take a picture of my back, and you can go to lakecoc.org. If you go to the menu, how to become a member, we meet every single Sorry, that sounded like a whole lot more. We meet once a month. We meet on the first Thursday of every single month. We meet at the Office of Education, Lake County Office of Education, which is right off of Main Street. We meet at 3 p.m., and everybody is invited, because you may just be the missing puzzle piece to the solution we're looking for. We want everyone's ideas. We want everyone to take part in our discussions, because guess what? We haven't figured it out. We're trying our best. We're doing what we think is right. We're doing what we've learned from others, but obviously the answer has not yet been there, or else we would say, we've solved it, let's go home. So please come and join us if you want to be a part of it. You don't have to be a member to join our meetings. We would love for you guys to become a member and participate and engage in a higher level, and that would be great.
Great. Okay, we talked about seniors before. I've got a question here. I'm going to read it verbatim as well. There's a very limited amount of housing for seniors, and to me, that smacks potentially of anxiety, of fear, lack of resources. The question then becomes, are there plans to build more senior housing?
So what's really good is the city of Lakeport, the city of Clear Lake, and the county of Lake have joined together to do something about housing. Rather than individually trying to figure this out, we have to figure this out together. And so we just passed a housing action implementation plan, and senior housing was high on the list. And so we are seeing the numbers rise in those experiencing homelessness that are seniors. We have to do something about that. That was a priority that I showed you, and that is something that I will be pushing for, and I hope many others will be pushing for, because it is important that our seniors, who are mostly on fixed income, do not get left behind.
Okay, I got one more for you, at least from this stack, and this is not the end of our Q&A. At every end of every section, there will be more spaces and more time for more questions and answers. I'm going to give you this, Bruno. There are 4 lines on this sheet, okay? 4 available lines for you to write on. This person has written 8 lines to them. Again, Chaplain.
I like this person already.
This is good, and this is why I think there's pieces to it. It's written in this really lovely script, in this really lovely cursive, but I almost want you to think about almost like a hyperventilation while I read this, because it feels like there is a growing level of anxiety line by line here. Residents in Lake County mobile home parks are facing immediate risk of homelessness. Landlords are raising rents multiple times this year and charging fees that will soon price residents out of the park. Some residents are experiencing retaliation for speaking out. The question becomes, what help and resources are available now for these residents?
Yeah, that's a problem that's been brought to the Board of Supervisors recently. I offered to be part of an ad hoc committee with Chair Crandall to discuss it. This issue was coming from his district, but this is an issue that every district is dealing with. What's unfortunate is we are in a time where we are seeing property ownership be in a smaller number of hands. And that is what's happening with our mobile home parks. What investors are told is, if you want to invest in housing, that's where you can get the best profit margins. And so they're really focused, those who have a lot of wealth, on buying up these mobile home parks because it's anticipated that it's a quick dollar in your pocket. Somehow or another, coincidence, things happen. I happened to be at a meeting at Sacramento, and a gentleman was talking about some potential solutions to mobile home park issues. And so I've shared that with the team that is meeting to discuss that. I have no promises today or any solutions today, but we are looking at ways to resolve this problem, mitigate the problem, and reduce the burden that is being placed on our seniors or those who are living in mobile home parks, because it's important.
Okay,
Sorry that that's not a specific answer, but I don't have a very specific answer to give you other than we are working on it.
And this is another plug for take a photo of that QR code, join the conversation, help us find the answers. We're not there yet. We're sounding it out along the way. Bruno, you and I need to get off of the stage and give people the opportunity to present who we've brought along. So I'm going to step out while you introduce the first group, and then we will run into more voices to work on this together. But I want to thank you for your questions. Keep going. Keep putting your hand in the air. Scott is going to continue to collect them. We are paying attention to the chat. Keep your questions coming.
Thank you, Jay. I am not going to introduce Ronnie because I've talked too much. Ronnie is an amazing woman who has been working really hard in Lower Lake and in Clear Lake. She works for Adventist Health, and she is the health management program director. I just made up a title for her. She does amazing work, and the people around her, she inspires to do amazing work with her. Please welcome Ronnie Duncan. Use that microphone.
Thank you, Bruno. Okay, I got a tutorial on clicking and talking before I did this, so bear with me. I am actually the, I think I have here we go. We'll go past that. We'll go past that. Okay, I'm a licensed clinical social worker. I have a master's degree in social work, and my background is in mental health, homelessness, and harm reduction. My actual official title is Manager of Community Health Programs at Adventist Health, and those include Hope Center, Restoration House, the Shower Trailer Project, the Lake County Community Hub, the Substance Use Navigation Program, the community health worker outreach program, and our CalAIM community supports. Just a few. The foundation of the work that we're doing is really centered around access to care. We are a healthcare organization, and I believe that people need health, they need well-being, they need substance use support, they need mental health support sometimes to get through the next phase. So helping people access whatever care that looks like in their world to help them stabilize and be healthy and move forward is really what we're about. We also are very big on building relationships, whether that's relationships in our shelters or our programs out in the community, with the COC, with our community partners. That's huge. And then fostering community. A huge part of what we do in our shelters is making sure that the people who live there realize they're community members and their voices matter. And we want them to step out into the community and be wonderful people that are speaking up and making an influence and making the community better. So that's really where we start. We've built our programs with the input of lived experience. The majority of our staff are people who have either gone through our programs or they have lived experience with homelessness, mental health, substance use. We really value their input. They help contribute to how our programs are developed and formed, and we're constantly learning through that process. I'm really, really proud of our employees. A lot of them have lived in our programs or received services from us, so that's a huge thing to me, to all of us. So the shower trailer project, it goes around the lake 5 days a week. The shower trailer is really a no-barrier program. You don't have to prove that you need it. You don't have to say I'm unhoused. You don't have to say I don't have running water. You just show up. We provide hygiene care. We provide access to resources, bus passes, ID support, document recovery. Whatever you can think of that we can figure out at that spot, we're going to try and do. We provided, so I only went back 2 years with my data. We provided 3,040 showers in 2024 and 2,444 showers this year as of July. 534 bus passes in 2025, 834 people got clothing, and we've provided 960 meals. We have provided a total of 11,000 showers since we started the project 5 years ago. Hope Center is our newest program, well, kind of new to us. We took over the operations of Hope Center in 2023, and it is a transitional housing program. We have 21 beds. We offer mental health groups there, support with NA, AA. We have case management, housing navigation. We really work with people on meeting them exactly where they're at when they walk in the door. Our case managers work on partnering with landlords and making sure that people understand, like we were just talking about the mobile home issue, that the people that we're helping moving into housing, that they understand what they're allowed to accept when they're moving somewhere, right? That they don't have to move into certain kinds of places and certain things to look out for when they're getting into housing. We also provide case management in regards to your medical care, your mental health. We connect you to all kinds of services. Whatever your path is at that time, that's what we're working on. We provide 2 meals a day. And since we opened our services in 2023 with Hope Center, we've served 186 people. See, darn it. Oh, I got to go up. Sorry. I knew I was going to mess the clicker up. So we've provided 186 people with a bed or shelter at Hope Center since 2023. And 61 of those individuals have been permanently housed. Going the wrong way again. Okay, so Project Restoration is our other shelter. It has 11 beds. We provide a medical recuperative care service at Project Restoration. You usually need to be discharged from a hospital, not necessarily. You just need to be healing from some type of medical issue. It's similar to Hope Center, it's just smaller. So we do the same services, they're just much more vulnerable people. So here we have our community health programs. Housing navigation, which is a CalAIM community support. We do this for anyone in the community that might be unhoused, they're experiencing homelessness. We partner with landlords, we help them get income, we navigate them in looking for housing, make sure that they are getting appropriate housing. Housing tenancy, we offer this once people have moved into housing to make sure they're stabilized, and we do that for 6 months after they're housed. And housing deposits. So I think I need some water. The housing deposit program is if you are not able, not able to pay a deposit or get into housing straight from homelessness, you may qualify for a housing deposit depending on what Medi-Cal deems appropriate, and we can navigate people through that process and help them get into housing with a housing deposit. Through that program, through our community outreach programs, we've served 262 clients, and we've housed 83 since 2023. So our funding consists of braiding funding. It's a combination of grants, philanthropy funds, donations, and what is called CalAIM community supports. So the state of California has done something new in the last 3 years with a Medi-Cal benefit, and this Medi-Cal benefit is housing navigation, housing tenancy, and housing deposits, among many other things, including recuperative care, which we offer at Project Restoration. This CalAIM benefit through Medi-Cal has allowed programs like ours to be able to sustain our programming because we can bill for some of the services we're providing for Medi-Cal recipients. So that's a really big part of our programming, and it's allowed us to not have to rely so much on the COC to provide grant funds to sustain what we're doing. What else? I think that's it for funding. So, lessons learned. In the last few years, we've learned quite a few things. There's a big boulder there and a guy pushing it up a hill because sometimes that's what the work feels like. It's not easy. Affordable housing is scarce in Lake County, so what we've learned is that we have to get really creative. We have to partner with our landlords and our community members and learn to advocate for the people that we're helping. And just sometimes it's about getting creative with, can you pair people up as roommates? Can you talk to a landlord about maybe being flexible on what they're doing? The work for the people who are doing the work is sometimes really hard. It's emotionally hard. You're working with people from square one off the street sometimes who may be walking in with just nothing on their back and need to start at the very beginning. And sometimes that can be really difficult. The availability of resources, especially in Lake County, is minimal. So that's another way we get really creative. We use our community. We try to figure out ways around getting people the resources they need. And part of that's partnering with the COC. Transportation. I'm not sure if anybody has ever ridden Lake Transit to get to an appointment and tried to get from Lakeport to Clear Lake or Clear Lake to Lakeport, but that's an all-day adventure. So if you're trying to plan your life and move forward and you're riding the bus to one appointment, that takes the entire day. That's a huge barrier that we are consistently trying to get around here. And then being willing to learn. We have learned a lot from our people with lived experience from our staff, from our community. We listen to them, we take their feedback, and we adapt our programs based on what we are hearing from them. The big lesson we've learned over the last few years is capturing accurate data to tell these stories, because the community wants to hear what we're doing, and the grant funders and the COC. Part of what we do is we enter data into HMIS, and what we've learned is if we are not accurately entering data, then we're not telling an accurate story for our funders. So our internal data is actually really, really good. We look really good for what we're capturing, but sometimes it's not aligning with what the county's capturing. So we're working on improving that process. And I think that's pretty much it for now. You guys can, if you need to refer people, you can use our QR code, you can go to the community hub, or you can call any of these numbers. And that's it.
Thanks, Ronnie. I am collecting tons of questions. Please keep them coming. We're reading them. We're seeing them. We are putting them together so that when this next presenter or the panel of presenters comes through, we can address them piece by piece. But next, we're honored to welcome a panel from Redwood Community Services, a key provider of homeless services in our region. RCS brings a trauma-informed, person-centered approach to supporting individuals experiencing homelessness and programs rooted in dignity, connection, and whole person care. Leading the panel is Sage Wolf, Integrated Health Director at RCS, whose work integrates behavioral health, housing, and outreach to meet people where they are. I welcome you to join me in welcoming Sage and the entire RCS team.
Thank you. Before I get going, Scott, because I see you and you're standing and you're running around, could someone bring bottles of water up for everybody? I don't think we realized just how dry we were going to be up here. So, where's the clicker? Clicker. Uh-oh. I have a feeling these, oh no, they are the correct slides. That's good. Okay, hooray. So Redwood Community Services, or RCS, I'm going to do just a very brief spiel about RCS. We've been doing work in Lake County. Our first project was in like 1996, I think, doing a foster group home. There was actually a couple that we did. Our focus was really in children. Over the years, we've expanded to do adult services, to do housing services. Our kids, we really just followed the kids, what they needed as they got older. That's a gap in our system, and we weren't able to find services, so we would put something else in. So we've been really dedicated to that kind of model of like, what does our client need? Okay, we can't find it, so we're going to try to figure out how to do it. Being part of the COC has made that work a lot easier, and being part of, working with Lake County Behavioral Health, that thing around we can't do this alone, that is very real. We have some kind of core beliefs at RCS around homelessness and housing that I think tie into that we believe that it is possible to end homelessness, and that to do it, you have to have a team, you have to have a whole community that's working together. So just want to share that before we dive in. I was going to say a spiel about, I guess I've been doing this work for about 25 or so years, but I don't really want to talk about my work experience. I want to just say that it feels really good to be doing the work that I am in this county. And when Jay said the thing about, when the question came up about mobile home parks, it really hit my heart. My birth story is one that I've always been really proud of, but it's a little unusual. So I was born not too long ago, but a while ago. But I was born in a shed outside of a trailer in a mobile home park in Nice. And my first couple, I don't remember being that in my life, but that was my parents' experience when I was born, was in not the best setting. It's Nice mobile home parks. I drive by it all the time now, and it's still probably about the same. But anyway, that's just a thing that, like, I think of that and go, some people would feel a certain way about it, and it makes me proud, and especially to be here now. I really want to talk about our why we do this work. And, as I said, we followed our kids, and what our kids needed, we would try to figure out how to put that in. When it comes to homeless and housing services, we started developing that, really believing that housing is a human right. You don't have to earn housing. Everyone deserves housing. And everyone deserves care. So with that, we started looking into what are the models that really go along with that. And what we found, and luckily it is supported by the continuum of care. It has been supported for decades on a federal level, and it is very strongly supported on a state level. The low barrier housing first model is when your target population is serving people who are chronically homeless, so they've been unhoused for a long period of time, you want to implement a low barrier model that makes as little, like, we don't want to say no. If someone's coming us to try to get shelter or trying to get housing or trying to get support, our goal is to never say no. And the only reason we would say no, we can't give you shelter, but we can give you this kind of help, is if our beds are full, because there's physically only so many bodies you can put in a building legally. And again, without putting people in positions where you're essentially abusing them by being a slumlord, it's really hard to balance that. How many people can we fit in a building safely and with a high level of health? But we want there to be as few barriers as possible. So with that, we follow a harm reduction model where we accept people who are under the influence. We ask people that are coming to the shelter to not bring their substances with them when they come to the shelter, so they really shouldn't be carrying their substances. Very strong policies around don't sell substances at the shelter or distribute. Like, that's a pretty strong, hard no. But we do accept people who are intoxicated. Both, they can be intoxicated when they come in, they can have a bed and get intoxicated and be there, and our main goal there is to keep them safe and to keep the other people in the environment safe as well. We also accept people who have pets. So we do have a 1 pet per person type of policy, because when you start getting more pets than you have humans, that's like, it takes away the space from the humans that you need. But that's all I'm going to, don't need to dive too deep into that, but I think you get the gist that our goal, get people in, and once they're into the shelter, keep them in. So I have a practice with the teams of saying, what have we done to keep them in their bed before we start looking at the reasons why we might need to exit somebody. It's been a really key piece, but it also means that we're balancing some challenges, right? Because part of our everyone deserves housing, how everyone deserves care is even people who have hurt people, even people who have hurt us deserve care and deserve housing and deserve shelter. So we really try and have a lot of practices that we have implemented to keep people in shelter, even when their behaviors are challenging for the rest of the community. The last thing I want to touch on here is housing first, because that hasn't actually, I'm really surprised. I don't think that the term housing first has been said yet. And this is where I'm looking at Bruno over there, going, before we started the presentation today, Bruno said that we could be unfiltered, that I was like, how filtered do we need to be? And he said, you can be unfiltered. I want to know what you think. So I'm taking you at your word, sir. Housing first is really about people don't need to show that they're ready for housing. You are ready for housing just because you exist. You don't need to graduate to housing. You're ready for housing. Housing first is about permanent housing. It's about supporting a system to grow in the permanent housing direction. I want to put our shelter out of business. I can't even tell you how much I would, let's do permanent housing rather than shelter. Shelter is absolutely needed. It is totally needed because we need those short-term solutions for the immediate, right now, life-threatening crisis that is happening with that person who's unsheltered. But ultimately, housing is the thing that solves homelessness. So Housing First really focuses on that permanent housing model. And the reason why I'm kind of looking at Bruno with this, like I might get in trouble for saying this, I am one of the people at the COC who is going to speak against transitional housing and short-term solutions. I'm going to speak for permanent housing and permanent solutions. Because if you invest your money in short-term solutions, and if you occupy your housing with short-term solutions, you are detracting from the finances and the housing stock that you can use for permanent housing. So if you have like a transitional housing program that is, a normal apartment, but you're using it for a short term, like the person can stay there for up to 2 years, well, then at 2 years, that apartment, you have to move out hopefully into permanent housing. But if you're taking up your permanent housing with those short-term programs, how is that going to work on a system like solving this level? Also, because the kinds of support systems that you can have when you're doing transitional housing and short-term housing, you can implement those same support systems in permanent housing. So the case, I'm going to get in trouble. You need that, if you need the support, yes. I think we might need a card to be able to ask some of these questions. Yeah, write it down, please. Or I'd be happy to have a conversation more deep about it because I love talking about this, but I also am really respecting that we have many other people to talk. So, yeah. What I'm speaking for, I really honor that. The experience that I think there's just such a variety of needs, and for both the solutions that you're offering, who it is that needs the help, it's very individualized, what each person needs. So Housing First looks at that and is a really just key component to the work that we do. So I want to touch real quick on the how we do our work in homeless and housing services. Speaking to the Harbor Youth Resource Center here in Lakeport. So it's a wonderful resource for transition age youth. And I am our Director of Integrated Health, and I do some support, but it's not my program, so I'm not going to speak to a lot of the details. I'm looking at Laura. So there's also our behavioral health services in Lake County, all across the whole county doing therapy, clinical work, behavioral health rehabilitation, school-based services around the county as well, so working with a lot of those families. The Nest is a transitional housing program. I speak about transitional housing and I do support it, but there's just some tricks to it. So the Nest is a transitional housing program for young parents that have children and are, so it's that short term, helping them get back on their feet, connecting them with those housing navigation services, finding housing for them to move into. It is a shared living environment, so you've got a house that's really shared by a number of different families. And then Thule House is a inpatient substance use treatment facility for pregnant and parenting women. Okay, thank you for the nod. Last thing on here, we've got our Pathways Support Services, which I'm going to let Courtney speak more to. Essentially, that's our enhanced care management and housing navigation. And then Homerton Haven Emergency Shelter in Lakeport. So I'm going to ask Gabby to come up. Gabby Panola. She is our supervisor of the Homerton Haven Shelter, and I'm going to let her speak to what we do at the shelter.
Thank you, Sage. Hello, everyone, and thank you for being here today and for your continued support of the work we do in our community. I'm honored to share a little bit about our 24/7 low-barrier shelter and the vital role it plays in providing safety, stability, and support for those experiencing homelessness in Lake County. Our shelter offers 35 beds every night and we operate around the clock to ensure that our guests have a safe place to reset and recover. We provide breakfast and dinner daily, and while we don't serve lunch, that's a deliberate choice because we want to make sure our guests can continue to use food stamps benefits without interruption. What truly makes our shelter special is the people, both those we serve and those who serve. Many of our peer support counselors have lived experience with homelessness, addiction, or mental health challenges. That lived experience allows them to connect with our guests in a way that's authentic, compassionate, and deeply impactful. They don't just offer support, they offer hope. We're also incredibly grateful for the community partners who step in to help, from social services assisting guests with medical benefits to the literacy program, helping folks build skills and confidence. We're surrounded by people who care and who show up. If you or someone you know is in need of shelter, we conduct screening intakes Monday through Friday from 1 p.m. to 3 p.m. You could come in person or you could call us, especially helpful since we're located just outside of Lakeport. Beds are assigned Monday through Friday at 3:30 p.m., and we do our best to prioritize individuals who are referred from hospitals and jails. We believe that everyone deserves dignity, safety, and a chance to rebuild. With your continued support, we could keep making that belief a reality. Thank you. All right.
Before you walk off,
Okay.
I started this by telling a little bit about our why. So I want to hear from you just real quick. What is your why? Why are you in this work?
For me, I like to, can you hear me? I like to, work with the folks who oftentimes they've gone everywhere and they've been turned away, and we're like their last hope, their last resort, and I get to be kind of the light at the end of the tunnel for them. Just helping them meet basic needs such as showers, shelter, food, safety. It's very important to me. I love the connections and rapport I get to build with them, and they're just beautiful people.
Yeah, thank you.
All right. Thank you.
All right, now I'm going to ask Courtney Hill to come up. Courtney is our support services supervisor, and I'm going to turn it over to her to talk about more than shelter.
Hello, everyone. It's really nice to see familiar faces because I really am not a public speaker, so thank you all for coming. I wanted to talk about a few things that mean a lot to me. Ronnie pretty much touched on all of it. I really loved what you shared, so thank you, because you gave the details that I didn't include. So let's talk about what stability really means and how we can all help each other in the community get to there. So shelter is not the finish line. It's just the starting point. We're all aware of that the finish line is really just safe, stable, affordable, permanent housing. And so because true stability, the kind that lasts, it takes more than just a roof over your head. It takes support, it takes connection, and it takes community. It takes someone walking alongside you, and that's why we offer enhanced care management, to meet people where they are so no one has to face the complex challenges alone. Whether it's mental health needs, chronic illness, or just navigating the systems that feel impossible, I've been there. Sometimes you don't even know where to start. We also offer housing navigation because finding the place, that's hard enough, and then staying there is even harder. So through housing deposits and stabilization support, we help people not just move in, but stay in. With the funding from Partnership Health Plan, qualified participants can receive up to $5,000 in deposit support. But the truth is, the need far outweighs the resources that we have available in our community, and it really takes, Lake County needs more housing, more funding, and more hands to help. So that's why it's nice to see so many of you all here and so many familiar faces. But because of when someone walks through the doors, they're not just looking for a place to sleep, they're also looking for hope. They're looking for safety, and they're looking for a way forward. And I believe deeply that stability isn't a luxury, it's a right. Everyone deserves a place to call home, and with the right support, we can all help them get there.
So I'm going to ask you also, why do you do this work?
So my why is pretty personal. I grew up in Lake County my whole entire life. I struggled with addictive parents. I struggled with being a teen mom at 16. I struggled with dropping out of school and having to go back and start over. I've struggled with moving out of county to go live with my mom, thinking things would get better, and then being homeless on the street, having to do the welfare program and the 14-day hotel stay, finding housing, and it's passionate. I know I would not have got through any of that without the helping hands that I found and the community people that helped me. I was, a 19-year-old young girl with 2 kids, not knowing anything, not knowing where to start, what to do. And there was just one person, and that's all it took to help me walk and navigate those systems. So I'll cry up here if I don't stop. But it means a lot to me, and everybody deserves somebody to walk with them.
Thank you, Courtney. All right, now I'm going to turn it over to our program manager, Zanya Leva-Jow, and she's going to share some about our data with heart. So, data with a heart.
Thank you, Sage. Before we get into the numbers, I want to take a moment and really reflect on what it truly means. Sorry. At RCS, we believe that every person deserves shelter, not just shelter, but dignity, stability, and a chance to heal. Our work is grounded in compassion and driven by belief that change is possible, especially when we meet people where they are. Since December of 2023, we've welcomed 234 people into the shelter. That's 234 lives met with warmth, safety, and care. This year alone, we've sheltered 126 people, supported 200 individuals through our Pathways program, and served over 18,000 meals, each one a reminder that someone matters. We've helped 9 people move into permanent housing, a milestone that changes everything. But what these numbers don't show is that 90% of our guests report having at least one disability. That includes chronic health conditions and mental health challenges, which means our guests are not just unhoused, they're navigating complex barriers every single day. These are not statistics. These are our neighbors, our community, and they're showing up every day with courage despite the odds. The value of this program lies in its humanity. It's not just a bed or a meal. It's stability, connection, and a pathway forward. We're showing that when we invest in our people, we build stronger and healthier communities.
What's your why?
So my why is, I've always believed that we're only as strong as our most vulnerable. And so that's why I do the work that I do, because I feel like if we're addressing and working with the most vulnerable, we'll be a stronger community.
Thank you. All right. Bruno also took my myths. I like taking advantage of any opportunity that I have to talk a little bit about the myths that surround homelessness. And even though Bruno did share already, I'm going to just put an exclamation point on them. So one of the myths that we hear is around substance use. And this ties into the prevalent misconception that if you're homeless, you must be on drugs. So because we're a low barrier shelter at Homerton Haven, there's a misperception that everybody at the shelter must be on drugs. Everyone. So at any given night, we have 35 people and all of them must be on drugs, right? That is not our reality. So our reality is that we work with every single person, gather their information about who they are and what their experience is like, really working with them, encouraging them to be as honest with us. And we're not gonna keep them from coming, they can still get resources even if they're honest. Really, we want you to be honest with us. So while we may not get 100% accuracy or honesty, I'm very confident in that we get a high level of honesty from the people that we serve. And of the people we serve, only 37% of them report substance use challenges. So that is 37% of our folks that have substance use challenges, and we are trying to support them with that. We're using those harm reduction approaches to welcome them in and help them live more safely and reduce their risks. It's also, 63% of the people that we serve, so 6 out of 10 who do not have substance use challenges. So there is also a community of people who support each other in recovery. I think it's an important thing to know that Hamilton Haven is not a substance use only shelter. It is anybody can come for the shelter. It's our goal, is just to be able to invite everybody. The other myth around this, that Bruno mentioned as well, is that the myth that having a shelter attracts people to come to your community. So the whole if you build it, they will come thing. And so, people must be coming here from Santa Rosa, people must be coming here from Sacramento, people must be coming here from San Francisco, right? Because we have a shelter. Well, I'll tell you what, those communities have a lot more resources in those communities to help those people than we do. So they're not coming here. And we know this because we do gather information both at locally and also on a state level about how people travel through communities to access homeless resources. So in Lake County, we know that the people we're serving at Hamilton Haven are deeply connected to Lake County. This is their home. Whether they were born here or they came here because they have family, they've lived here for 18 years, this is their home. Also, if it wasn't their home, we're going to want to help identify where home is, because people have a much higher chance of resolving their housing crisis if they are somewhere that they see as home. So that's just another little key point there. But on a state level, the data that gets collected it's been a really wonderful shift that's happened over the last couple of years, where the state is collecting the HMIS data on a depersonalized level, so they're not getting your name or your social security number or your date of birth, those sorts of things. They're just getting the meat of this is a unique individual. So that data that we enter gets shared on this is a unique individual with the state, and they can then see, does that individual visit a continuum of care, a COC, homeless services in another COC? So for example, they could see if someone from Lake County was then going and getting services in San Luis Obispo or getting services in San Jose. And what their data has shown, and we're talking about hundreds of thousands of people that they are being able to really see how many homeless systems of care are people connecting with. And 96% of the people who accessed COC services were in one COC region. 96% in their home region, people stay home. There was an additional 4% of people who accessed services in 2 continuums of care. And when they looked at that, it was neighboring continuums of care, meaning Lake County burned down, people went to Mendo temporarily to get help. Please do that. Really. There was just a weird sound pop, sorry. So the less than 1% of people that accessed services in 3 or more communities, 3 or more continuums of care. This is, to me, one of those people want to get help where their home is, and they'd rather stay in a home in discomfort than have to leave and go somewhere else. I think with this, it's hard for us as a society to look around us and see the hardship that people live in and think of them as ours. It's easier to look at people and think of them as they're not from here. These aren't our people. They're not my neighbors. They came here from somewhere else. It's a lot easier on our heart when we think of it that way, because it's really hard on our hearts when we look around and see the people who are living in hardship and go, wow, that is my neighbor, that is my person, that is my community, that is our person. It's a lot harder on the heart. So there's a lot of things we do to create myths and stigma that really come out of a need to protect ourselves. The other little myth that I want to share is about a thing that I hear where people say that most people choose to be homeless. And I've been doing this work for a long time. And I've talked with a lot of people, so I have a lot of anecdotal, so not hard facts, right? Experience around people, asking people, what happened? Why are you experiencing homelessness? And them telling me their story. I've come across some people who have initially said that they chose to be homeless, but when we really dig into it and ask them about what kind of housing would work for them, what kind of housing do they want, or why don't they want housing. The answers that we get are they can't bring their dog. They have a criminal record, so they won't pass the background checks. They are a senior, which a lot of the folks that we're serving are seniors. So they have a fixed income, which I heard a wonderful, or a like kind of horrifying thing, or maybe like it was a light bulb a while ago of not just that they have a fixed income, but there is no realistic expectation that their income will increase. So how are they going to pay rent? There are very little rental subsidies or places that are, doing vouchers to help you pay rent, and that is so hard when you don't have a way to pay rent yourself. So when people say they choose homelessness, really it's that they haven't found the housing that will work for them, is what we've experienced. And really, again, it's a lot easier to say, I chose this, I accept this way of life, and this being me, I chose this. It's a lot easier to say I chose this than to accept that I am stuck in this position with people treating me like, It's a lot easier to think you chose it. So, real fast, my why, because I just can. My why is, so after being born in Lake County, my parents moved around a little bit. And then when I was 7 or so, my parents had separated, and my mom took me and my sister and moved us out into a tent on some family land. A tent. We stayed in that tent on that land for 7 months, and I was 7 years old. I thought it was delightful. This is fun. I love it. I was always outdoorsy, like my whole family was, like, this is great. We had horses. My mom built a barn for the horses, so like they got taken care of and had like kind of running water. We didn't have running water for sure. We didn't have electricity, all of that. Like it was just, a bucket outside for going potty, all of that. My sister got frostbite. This is like Northern California. Who gets frostbite in Northern California? I mean, it's cold, but it's that cold, so yeah. But I, of course, this is just fun. This is cool. And so that was for about 7 months when I was 7 years old, and then my mom got a trailer and put it on the property, and we lived in that until I lived in that with my mother and some other people for a while, till I was 18 years old. And so from 8 to 18, I stayed in this trailer where we barely had electricity. We didn't have electricity for years. And again, this was normal. I went to a conference a couple years ago, and I was listening to this workshop, and the woman was talking about the importance of lifting people with lived experience up. And she introduced herself. She's the executive director of an amazing organization in San Francisco. And when she was talking, she started talking about how most people don't even realize that they've been experiencing homelessness. They had a car they could stay in, so they weren't homeless. They had a hotel that they could stay in for a while, so they weren't homeless. They had a friend's couch that they could sleep on for a while, so they weren't homeless. Maybe they spent one night on the street or something, but they had some way of not identifying themselves as homeless. And while I was listening to her, I went into a full-blown panic attack and had to leave the room. I just melted. I crumbled into, I was a hot mess. And luckily Luna was with me. I was okay. Everything was fine. Some people stopped in the hall to try to check on me and everything, but it hit me. What mother takes their 7-year-old, my sister, and 14-year-old children to stay in a tent on a piece of land that barely had a road to get to where the land was? What mother would do that? So I called my mom and asked her, and the story that she told me was enlightening. And essentially she was escaping domestic violence, not from my dad. He's a wonderful human being. I love him to pieces, but they had separated. So I got to get hit with this. Wow, a majority of my childhood was living in a place not meant for human habitation, in that it didn't have running water, it didn't have electricity, it didn't have a toilet, we had an outdoor shower. Anyway, all that. My why is because we all matter, whether we realize that we are homeless or not. We all deserve housing and care. And I don't want to see anybody thrown away in the kinds of ways that I've been thrown away in my life. So I'm here fighting for systems where we get to keep people. contact information up there. Thank you. Thank you.
Thank you, Sage. If we could please have a round of applause for both of our providers that have provided their presentation. And now we have some questions.
We do. The great part of you putting in questions is sometimes you put in a question and then somebody gets up and answers that question, but I want to make sure we honor the fact that questions did happen. The question was, where's the best place to direct an unhoused person, both emergency and non-emergency? I feel like we just got that answer. There was a slide. If you need more information on that, Sage will be available for those pieces too. Do you feel like we answered that question? No? We didn't answer that question. That's a really great question. Nobody answered it. Sage is going to answer it right now.
I'm going to answer it, but not with good addresses because I don't know the addresses to places. So one, Hope Center in Clear Lake for sure, right?
For
yes.
sure, yes.
Go there. But
Shower
obviously
trailer.
this is a big county and like you're not necessarily going to be unhoused in Clear Lake, or the person might be in Lakeport, or they might be in Kelseyville. Anyway, there are peer centers around the community. So there's the Big Oaks Peer Center, there is the Circle of Native Minds, there is the Harbor Youth Resource Center, which is a TAY-focused drop-in center, but it also does door service for any age, where people can come and ask for support. Other peer centers, Los Lavos. So look up the peer centers, and yeah. That's key, because that question of like, you don't want to walk all the way out to Homaton to do, get to a peer center and call the shelters.
Thank you, Sage. Okay, a couple more that we've got pieces too. This is a PIT question, so this might go to you, Bruno. Do we know or do we ask the reasons why people become homeless during the PIT count?
Yes, we do.
Technically, that's the end of that question.
I think that was a one-sentence answer.
It is. It's good. There's more to it. The solution needs to solve those reasons. It isn't usually drug use that happens after someone becomes homeless to self-medicate or deal with the drama.
And I mentioned earlier, we asked very specifically about the fires. Those are unique to Lake County. We want to understand what the impacts are, but we do ask a question with a long list of how did that happen?
And
how
then
did you become homeless?
The other piece becomes, join the COC, help us figure out how to do the thing that needs to do the thing for the thing when the thing happens. That all made sense, right? Those are all different things. Good. Bruno, one more. Will campers be allowed at safe parking sites?
While we're still negotiating with the contractor that we chose, my hopes and desires is absolutely yes. We need to be open to inviting those that need the help, not being restrictive to those that need the help. So I think we need to wait until further notice to really say yes 100%. But the idea is to open up a parking spot to a vehicle, not a specific type of vehicle.
Got it. Okay. This is a really great balance question. Before we had a conversation about what do we do about unfair practices with landlords. I think we may have a landlord here. This question says, small-time landlords provide approximately half the rental housing in California. What support do you provide for landlords who take the chance on a risky tenant and get burned? Ronnie knows the answer.
I know within our organization, we work very hard at preventing the landlord from getting burned. So we're working with the person while they're in housing to make sure that that doesn't happen. And then we try to find a solution. If it means that they have to move out so the landlord doesn't lose their money, then we work on finding a new place for that person to go. So we're very big on landlords not getting burned. And that is a huge part of our housing tenancy process.
And we're going to have the questions right there, and we'll go ahead and continue the conversation after the fact. But landlords are part of the partners.
Part of the partners.
Landlords are partners to help make sure we have housing. We have to have good partnerships, and anybody getting burned is going to hurt our partnerships.
Okay, here's one. How does the LCCOC plan to help those displaced due to their homes being red tagged with nowhere to go? What if it's one small thing that needs to be fixed, but they can't afford to fix it?
And I think the COC has services through the memberships that we have that could potentially help. They're very specific for who and how they can help. But I would say you need to reach out to the COC, you need to reach out to Red Cross, you need to reach out to others who have the ability to help you in those types of situations. Really depends on the scenario, such as do you own the home, are you renting the home? Things like that really matter to really figure out how it is that help can be provided. So please make sure you grab the pamphlets, find the numbers, and give us a call, and we'll see what we can do to help you out.
This is a really
There's many programs that can help.
Many programs. This is a good way, like a segue here for us as well. The next couple of questions, they all have the same answer, and they all kind of sound like what Bruno just said, which is we can give you answers from here, but really we've got a team of people at the info booths afterwards that you can go back to and ask them these questions directly, and they'll be likely better equipped to answer this. This one's not even a question, it's just a statement. We need more warm, understanding people, warm clothes, shoes, housing. Thank you. Go see our info booth outside. You will meet those warm people that we think we've brought into this space. So please, if that was your comment, join us, meet the warm people, find out where we can find them warm things. When should we?
We could use a little bit more warmth in our country, our state, and our communities.
Well said. Another question. The answer is the info booth. So I'll give you the answer, then the question. When should we expect some of the services that have been mentioned to start helping people? Please go talk to those groups at the info booth. They will give you the answer. The next one I'm not going to read out loud. Somebody wrote about their personal situation, how many hours a week they work, where their credit is at. Please go talk to somebody at the info booth directly. They will give you a better answer for all of these things and be able to help you, not necessarily for this group. And then here's another one. If 1,378 people have been served with the $6 million used, what is the breakdown of dollars per person? I went and asked that question to Scott. His answer was this: it depends on what services you need. So if you need rapid rehousing, if you need emergency rehousing, if you need this, if you need that, the dollar amount goes up based on what you need. So there isn't a like per person, each person gets a specific amount of money. They get a specific amount of services. Those services cost dollars. That determines how much of the $6 million they eat. Did I do that right, Scott? Great. I'm a humanitarian. I had the humanities degree, not a math degree, so I'm surprised I fully understood that question and the answer. Here's the last one.
Can I pause you for a second?
Pause.
When we say we serve 1,358 people with approximately $6 million, that's $4,418 per person.
Maybe, right?
My teacher never said I'd have a calculator in my pocket.
This is good. They were wrong. Okay, last question, and then we're going to transition, and this is a great segue. I mentioned the book, Until They All Have Faces. Somebody asked the question, I have tried unsuccessfully to purchase it. Where in the world do I get the book? I will give you the rest of the title so that it is more helpful to you to find it, because ultimately there is an answer. I don't want to say like be pro Amazon in this case, but if you were looking for Amazon, you could find it there. So the actual title is Until They Have Faces. So that's the first part. I said Until They All Have Faces. The title is Until They Have Faces, 110 Interviews with the Homeless People of Auburn, California. You can find it right now on Amazon. You can find it other places. You can find it on eBay. I will say the hard copy of this, for some reason on Amazon, is $100, which is wild. But the Kindle version is $10. So if you have the ability to see it on a digital copy, you can find it there. The library, the one thing we found in this question is that Amazon plus library searches find a difficult comeback for this. So you can start there and then trickle back from that place. But that's where I'd have you start. The reason for that being a segue is that the end of this time, at least for us, is not just going to be statistics and data. It will be spending time with people with lived experience. And so I'm going to step out of the way and provide room for three people to come up. You're first going to hear from Maria Petterly, then from Randall Goodwich, and then finally from Robert Sexton, who have been willing to share their story with us, to be vulnerable with us, to talk about their experience going through these process. And I want to start by first welcoming up Maria.
Hi, my name's Maria. I have been dealing with housing instability for most of my adult life. Almost 5 years ago, while already living in my car, I lost my job after 6 days of no contact due to being hospitalized after a suicide attempt. It was me and my cat Angel, with all my belongings living in my car, now with no income. Life went from bad to worse. Around that same time frame, an article was published about the Hope Center's grand opening. I immediately signed up and even went through the intake. That's when I found out I couldn't have Angel with me. I just couldn't do it. She was my world and the only thing I had to live for, so I declined the bed. I started staying in the area the locals call the Flats. The entire area has the most dirtiest dirt you can possibly imagine. It's so dirty, it's almost impossible not to get staph infections out there. I ended up taking someone to the ER because their infection had gotten so bad. While we were there, we were briefly told about the shower trailer project. At that time, there were no flyers or advertisements of any kind, but knowing about its existence and location, I started making calls to find out the days and times it was open. First, I called the senior center because that's where I was told it was located. The senior center, being unaware of that information, suggested I call the city of Clear Lake. The city of Clear Lake didn't know the hours of operations as well, but they informed me it was ran by Adventist Health and directed me to call the hospital. Being frustrated because I felt like I was getting nowhere, I made that third call. The receptionist I spoke with at Adventist Health didn't know either, but she was adamant that she should have that information and would find out and call me back. Since I was losing hope, I was sure I wouldn't hear back from her, but to my surprise, she actually did return my call with the information I was looking for. As I was the only one out there with a phone at that time, it dawned on me that I had just been an advocate for myself and others to get that information, especially when a week or two later, flyers were posted everywhere. So ever since my suicide attempt, I had been feeling like I had a purpose. I just needed to figure out what that purpose was. If it was only that simple, right? Well, this event helped me to find my purpose, which is to be an advocate for others like myself who are experiencing homelessness. Quite some time later, after painful circumstances beyond my control, I no longer had my cat Angel by my side anymore. And as much as it broke my heart, I had no more excuses to avoid utilizing the resources at the Hope Center. I signed up for services once more, and a week later, there was a bed available for me. Before getting accepted into the Hope Center, I had gotten dangerously close to going septic twice due to how bad my teeth were. Once I moved in, I was able to work on my physical health by having all my teeth pulled and start on my path to recovery by working on my mental and emotional health as well. Since living at the Hope Center, I've had the honor and privilege of joining the Lake County Continuum of Care, and I am a proud member of the Lived Experience Advisory Board. I have also used my lived experience to be a volunteer with the Pit Count for the past 2 years. These experiences reinforced my belief that I had finally found my purpose to help others become an advocate. But how do I get there? Although I had figured out that my purpose was to be an advocate for people experiencing homelessness, I was completely lost on how to attain this goal. Thanks to the Hope Center giving me resources on different programs and options available to me, I recently completed the 80-hour Medi-Cal Peer Support Specialist training. In the process to get the certification needed, I've recently received approval to and have actually scheduled the exam to become a certified peer support specialist. Again, thanks to the Hope Center and the wonderful people that work there. With the help and guidance through this recent stretch of my journey, I now stand here before you finally proud of myself. And for that, I will be eternally grateful. Thank you all for this opportunity.
Thank you, Maria. Public speaking is really difficult. You made that look incredible, so well done. I would now like to introduce Randall Goodrich to come up and share a little bit of his experience as well.
Hello, my name's Randall. I'd like to share my lived experience at being homeless with you. Okay, I was born and raised here, actually about 3 blocks from this very spot. And I never thought I would be speaking here. I've been here when I was a kid, many times as I could, watching movies. Whenever they'd let me out, I'd come here. And okay, in 2022, my house caught fire. I was living in Upper Lake. And my wife left out of state and left me to my own devices. And I was living in my car with a cat and a small dog and couch surfing for up until this year, March of this year. And I started to get sick. My mental condition was decaying. And I had heard about the shelter in North Lakeport, but I guess it was my pride or something was getting in the way. I didn't want to go there and ask for help. But eventually I did. And they accepted me with open arms. And they made sure all my medical needs were met, even mental health. Made sure I had food stamps. And then about 90 days into it, the housing coordinator found a house, and I'm renting a house with, they covered the person last, and I'm renting a house with 2 other residents there at the shelter. And they're great. They hooked everything up, and all I had to do was ask. So I recommend, if you're out there being homeless, ask for help. Okay, that's it. Thank you.
Thank you, Randall. I appreciate your vulnerability and for that recommendation that comes with it. I'd like to now offer you the opportunity to help welcome up Robert Sexton, who will close out this section.
Sorry if I move this around a little bit, or I got to go home after this. All right, good evening, ladies and gentlemen. My name is Robert Sexton, and I would like to take this time to tell you about my lived experience in Lake County. During the past 3 years of my life, I have met what I can say have been some of the most difficult times, if not the most difficult time of my life. In 2022, I separated from my wife of almost 8 years and what ended in a devastating divorce. My marriage ending stemmed from an extensive amount of arrests and legal issues, and also what anyone would say was a very chronic addiction to methamphetamines and many other substances. My divorce had placed me into a situation to where I lost my home, a 147-acre property, and everything else materialistic that I had ever worked for. The worst part about this is that I lost something much more important than homes, property, and certainly anything materialistic. And that is my wonderful children that are my world. During this process, I was forced to live on the streets of Lake County, California. I would not know, but at the time, the first week or so just felt like a camping trip. Little did I know that I would spend the next 2 years living in a creek behind the local shopping center and panhandling in front of every local store and corner in the Clear Lake area, just to feed my addiction and ease the pain of the loneliness that was growing with each day and night that passed while living on the streets. My drug addiction grew to an extent to where my entire family and friend base turned their backs on me and gave up. I was left with zero support system during a time that turned into the roughest and scariest part of my life so far to this day. While being homeless, I overdosed off illicit street drugs 6 times. This being something I never spoke of until this day due to the fact that this is the darkest part of my life. If it were not for Narcan, I would not be here standing tonight telling you my story. After about 2 years, I was referred to a low barrier housing community called the Hope Center, where they focus on many things like people's physical health, mental health, and employment. Not only that, but their primary goal at the Hope Center is to curb homelessness and help individuals like myself obtain their own form of healthy boundaries, healthy relationships, and most importantly, a healthy living housing environment. When first being accepted into the Hope Center, I had exactly 2 weeks clean off of substances. I was just released from the Lake County Jail on July 27, 2024. At that time, being the day that I chose to turn my life around, this date also being my recovery clean date. I had never heard of the Hope Center or any other services that they have to offer today. When starting my residency at the Hope Center, I asked for a shower because I had not showered in an actual shower in over a year. I remember my skin being so dirty that I could not stop scrubbing my body with the clean wash towel that I had been given when entering into the Hope Center. While taking my shower, I scrubbed my skin raw from the discomfort of who I had allowed myself to become. Living on the streets left me empty inside. I felt completely disgusted by the way that I looked and felt. I had what I believe was my first actual breakdown from my mental health declining, and I began to cry while showering, and not from joy, but from my mental and physical exhaustion that I had been through over the past few years while living on the streets. I had never been so embarrassed and upset with myself in the lifestyle that I was currently living at that moment. My hair was very long to my lower back, and I cut it all off so that I could get a small glimpse of who I used to be before my addiction stripped me from everything I was and everything that I stood for as a son, a father, and as a man. My first day at the Hope Center would not be long. I was exited 3 weeks into my first day at the Hope Center and was back to the streets. I lost my place at the Hope Center for not following their community living rules. About 2 weeks after being exited out of the Hope Center, I was given one more opportunity to become organized and work a straightforward program under Adventist Health guidelines. An Adventist Health employee by the name of Chrissy would later become my caseworker and an incredibly significant person in my life-changing experience I was being given to get off the streets and free of addiction. For about the next 5 months, I worked very closely with 2 women from the Hope Center who would both be assigned to me as my case management workers, those 2 women being Chrissy and Tamala. Together, they both worked with me in ways that nobody had sat down and worked with me in over 23 years. I've spent over half of my life involved in the criminal justice department and battling legal issues to where most people washed their hands with me and never taught or showed me any type of right and honest lifestyle. They focused on my physical health and primarily my mental health status due to the fact of becoming homeless causing my mental health to drastically decline. I felt as if I was suffering in a mental way I had never felt before. In 2022, I was 180 pounds and extremely healthy. 2 years on the streets took me down to 110 pounds and on the verge of death. The Hope Center was able to help me with calendaring all my doctor's appointments, including dental and vision, and as well, which is part of their care plan at this facility. In just a few months, the Hope Center, with my want to live longer and hopefully fulfill my dreams of having a place to call my home again, I would become that much closer to that dream. The Hope Center 100% saved my life at a time when I was ready to call it quits altogether in life. A very good friend and man who was a recovering lifetime addict and as well spent over half of his life incarcerated would agree to take me under his wing and help me continue to stay on track and keep living a clean and sober lifestyle so that I could beat the odds of every other young male in today's world. That man's name being Timothy Cantrell, also a resident and former roommate at the Hope Center my entire stay. I was enrolled in college at Woodland Community College and attending outside treatment for drug addiction through Adventist Health with their treatment counselor, Denise Newman. At this time, I was also attending AA and NA daily, 7 days a week, sometimes twice a day. For the first time in years, I was sleeping in a safe environment nightly, getting healthier, and life was advancing in all the possible positive ways. I was working on getting back into my children's lives through working a straight and narrow program and focusing only on the positive things that the Hope Center was placing in front of me to run with. I felt amazing, and for the first time in years, I had a smile on my face and hope in my heart. In the early wintertime of 2024, I went to court for a family law proceeding and to complete my divorce after 2 very long and depressing years of my life. Life was not as great as I thought it was. The courts would end up remanding me in family court for several outstanding criminal warrants. I was back in jail in what was looking like prison for 11 years. This would be a very eye-opening and life-changing event for me. The first thing I could think of was to write the Hope Center and let them know exactly what had happened and how sorry I was for ruining the opportunity that they had given me over and over. I wrote to the Hope Center twice a week, sometimes 3, hoping that I would get a response. I wrote to them about my mental health and my well-being, letting them know my mind was right and I was staying positive no matter what my situation was looking like. I was facing 11 years for being an addict and a dealer. I explained to them that I had let my children down again and that I was not going to be able to be home for them for Christmas, let alone be able to give them a good Christmas like my parents had done when I was a kid. I sent my address and all my children's names and ages in hopes that somebody would reach out to my children and bless them for Christmas. 3 very close friends of mine to this day who helped me through some of the roughest times that I have endured mentally and health-wise in my life, and those friends' names are Richard Woida, Timothy Cantrell, and George McKisson, who I attended a 12-step program on a weekly basis with, and as well who were housemates in the community housing center would reach out to me. I received their letters with nothing but inspirational words and positive feedback on who I was as a man and being able to accept the barriers I had overcome just to end up in jail. They would also respond by placing money on my books and letting me know that they would step up and buy my children their Christmas gifts and make sure that they received them. I broke down in tears in my cell, but tears of joy that people actually cared about me, and especially my children. Richard Woida would write to me weekly with promises that life would get better and life would reward me for changes I have made in my life. He would send me quotes and scriptures from the Holy Bible that would ultimately allow me to stay right mentally and spiritually with my higher power. During the time that I served, Richard would become my sponsor and would work on me with 2 different 12-step programs, all through paper and pen. He pushed me to write to my family and to make them aware of my legal issues in hopes of getting help from them or even just making proper amends through paper. I would write to him telling him that I can do 11 years with no problem, but the scariest part was coming home to nothing but the streets and I would be back to square one, not only with my addiction but with my housing crisis. After spending months in the county jail, my attorney, Ray Buenaventura, who is our county's acting chief public defender, was able to get me released under special probation conditions. It was a miracle that I was being given an opportunity to fix my life that I had damaged so badly. I was so nervous leaving the county jail that I would fall right back into addiction behaviors and go left when I should have gone right once again in my life. When released, I had 27 cents in my pocket and a broken cell phone that was damaged in the jail's property storage. I had no way to contact anyone, so out of fear, I ran towards Clear Lake. During the entire way to Clear Lake, making my way towards Lower Lake, California, I wanted nothing to do with anyone and just wanted to go back home to the Hope Center. I could feel it in my heart that they were waiting for me to come home. At least I hoped that they were. When I was sitting in Lower Lake at the Chevron gas station, an older gentleman offered to buy me a soda and to give me a ride to my mother's home in Clear Lake, which I had not spoken to in 3 years due to my drug addiction and losing my children. My mother would welcome me and fall to her knees in tears, holding around my legs, begging for me to get my life together. My mother told me to sit down. As she took off my shoes, she washed my feet while continuing to cry. I spoke to her and I said, "Mom, I love you and everything is going to be okay." My mother would reply by saying, "Son, I am sick and I am dying. My cancer has returned over the past year and I am leaving to go home to Santa Rosa, where I want to spend the rest of my time on earth with my children and loved ones." She would also say, "Son, I am cleaning your feet to prepare you for your new journey." My mother said, "Son, you need to go home to your family." I said, "Mom, I have no family other than you, and I want to leave with you." She said, "Son, the Hope Center is your family. Go home to your family, and they will open the door like I have, and they will open the door for you just like I have." Not speaking to my mother for 3 years and her knowing that the hard work that the Hope Center and I were putting into getting my life back together is still a mystery to me. I called the Hope Center and I remember the front desk answering and being so happy to hear from me. They put me through to Carissa, who oversees the day-to-day routine and organization at the Hope Center. Not only that, but also outside community activities to curb homelessness and other county-wide barriers related to homelessness. The first question Carissa asked me was, "Robert, are you okay?" I informed her of what had happened, and she says, "Robert, it does not even matter. We are here to help, and I want you to come back to the Hope Center, and we will make room for you." When going back to the Hope Center, I was so happy because I know that without their help, I would have died almost 7 months prior. When entering the Hope Center, I was welcomed with open arms and a Christmas tree surrounded with gifts from my children. I broke down inside and promised myself that this was the day that I would officially fight back in life and become an outstanding and beneficial person to my community. The Hope Center got me back on track and, like before, worked with me even closer and pushed me every day to reach excellence. After returning to the Hope Center, I was able to continue schooling at Woodland Community College with a major in human services in hopes of reaching my inspired goal of being a recovering addict and by giving back to my community by becoming a drug and alcohol counselor. During the past 8 months, I have reached so many goals and achievements that it is unreal to me still. I helped organize 2 separate Narcotics Anonymous 12-step meetings that take place Tuesdays and Wednesday nights, in which has had a very successful turnout of about 10 to 12 people per meeting, with attendance being at least half Hope Center residents and a few that are even of service to those meetings. Though the Hope Center does not focus on sobriety, they do believe that recovery comes in many forms, being recovery from addiction or recovering from homelessness, and are open minds to any way to beat these barriers that greatly impact our community in such negative ways on a very normal basis. In May of 2025, I received the first scholarship by Partnership Health Plan of California that awarded one person $10,000 and 4 people $5,000 towards a higher education by submitting an essay and letters of character in which 3 employees from the Hope Center gladly wrote for me, expressing my recovery and my resilience to bounce back from homelessness, and their desire to see me win the scholarship and be able to give back to my community one day with my knowledge through education and lived experience. This would be the first award I had ever won in my life. And it was offered to me through the Hope Center in February of 2025 by Carissa. Since I have also been awarded 2 more additional scholarships through Woodland Community College, one scholarship being the Foundation Scholarship and the second being the Sawtell Scholarship, which are both internal scholarships offered through the college. Once I graduate with my degree in Human Services, I plan to attend law school in Sonoma County so that I can advocate legally for people with substance abuse-related crimes and other legal setbacks that they may be currently facing in their lives. I know that my reason for becoming homeless was due to the many addictions I was suffering from. I do not wish addiction or homelessness or any of life's struggles that I have endured on anyone, because very few will make it past those struggles. I could admit to myself that I am a better man than I was 3 years ago, and have a flame that the Hope Center has lit inside of me that never gets duller. As of September 23rd, 2025, I am not only halfway done with receiving my first college degree, I continue to strive on a daily basis to have my children back in my life on a regular basis. And on top of that, I am 4 days shy of being 14 months clean off of narcotics and have acquired my own place of residency. I have acquired my own place of residency in which I share with a former female resident from the Hope Center who was present today and living proof of why not to quit before the miracle happens. Today I work 2 jobs, which are the first legal incomes in which I worked as a full-time IHSS worker and a peer mentor at Woodland Community College. Today I never have the thought to complain or slack at my jobs. Today I have a wonderful, sober, and inspiring girlfriend, and as well, she is a colleague of mine who is in my life on a daily basis and who sees me for my wins over my struggles and values me for me and has stood by me every moment of every struggle I have gone through this past year. 3 years ago, when I was on the streets, I thought that life was nearing an end. Today I have built this incredible social network that is full of people like me who have struggled and bounced back to build an unbreakable foundation that is going to give back to our community in ways that the Hope Center has given to us. My current goal that I'm working on is to give back to my community by starting a nonprofit business that is a community-based hub that specializes in providing resources to anyone suffering from homelessness, mental or physical health barriers, and even addiction problems. My future nonprofit will be called the Marathon Recovery Center. I think that the most knowledgeable thing that I have learned through this lived experience is that the biggest business that you are ever going to have to manage is your own personal life outside of any other businesses that you may have going on in your life. The business of your own life needs to be managed first. You must be straight with not ever being recognized in ways that you personally expect. It is very important that you do not allow other people's expectations to distract you mentally and be comfortable with your own goals and expectations of yourself in life. I've also realized you must always be yourself and make that a principle to live by, because life has so many personal ups and downs that will make or break you on a daily basis, and it is up to you to decide that outcome. I have learned a very distinguishing quality about myself after going through the tough experience I have lived over the past several years. And that is the personal drive that I have had since birth to never quit or give up on myself, no matter what the struggle may be in life that I have encountered. Every night before I sleep, I tell myself that I am completely comfortable in my own skin, so that when I wake up every morning, I can be happy and accept who I am and the struggles I have overcome. The starting point in my achievements thus far started with a desire. I taught myself that if I had a weak desire to change, that would bring 100% weak results in my life. Exactly the way a small flame brings a small and weak flame of warmth to somebody. My motivation was self-built, and I found out only I could create it. I noticed that if I were to stay unmotivated, I would never have had the help of the strong support group of the incredibly strong woman that I have by my side today. The Hope Center has helped me build a strong inner motivation and a drive inside me that is made to build success. 3 key components I've learned to make a self-comeback built by resilience to bouncing back from the worst downfall of my life to this point are patience, hard work, and dedication. I have had so many people turn their backs on me throughout my life, but I owe 0 financial debt to anyone on earth today, and one thing that I do know is that I owe my life to the Hope Center for never once giving up on my personal journey to recovery and allowing me to have another day at life and as well a chance at being a decent, successful person in our community again. Thank you.
Thank you, Robert. We did receive a couple of questions for our people with lived experience. Randall, I'm going to start with you. I'm going to put you on the spot, my friend. If I was to ask you this question, people are interested. What is one thing you would want people to understand about your experience? You gave us such a brief piece to it about your experience. What's one thing you would want people to understand about your experience that's unique to you?
Well, I found out that, well, it's not unique to me because it applies to every homeless person, I do believe. It's being stereotyped. And it's just, there's nothing fair about it at all. And I don't know if there's anything I can do, but, you know, not all people are bad. And some people desire to be homeless, you know, they like that, but a lot of people don't. That's it.
Thank you, Randall. Maria, I got one for you as well. In my work as a chaplain, I get to ask this question a lot. I have people make I wish statements. If there was a service that you wish you could have had throughout your experience, what's a service that you wish would have been available to you?
I personally wish I would have known about the shower project sooner. This is the first but the top one would be the shelter with animals. That would have gotten me off the streets so much sooner.
Thank you. Robert, question for you. So you've done such a good job in that reflection. You looked inside of yourself through all of these things. This question is actually reflecting outside. If you will take a moment, what is one way that we can be better neighbors to those who are unhoused?
Being kind. Like Randall was saying, I think that, is it Randall or?
Mm-hmm.
You know, when I was homeless, one of the worst things that I experienced daily was the way that the people in my community would stare at me. I had things thrown at me from vehicles. You know, I had people wave money in my face and pull it out of my hand when I would walk up to receive it. And, you know, mentally that's very hard on somebody. Not everybody that's homeless is an addict. Not everybody that's homeless chooses to be homeless. There's so many things that we experience being homeless that are just unreal to most people that have never experienced it. And I think that just being kind or even just walking up and out, you don't have to give somebody money if you don't feel comfortable doing it. Don't do it, but walk up to somebody and ask them how they're doing, because it creates a huge peace of mind when you're homeless just to have somebody say hello to you.
Thank you, Robert. Thank you again to everybody who is willing to share. It takes a lot of courage, a lot of bravery, a lot of vulnerability. So thank you for being a part of that. I just have one more, Bruno. The last question on our list, which I don't even think we can answer right away, but this is a good one. It says, will there be more accessibility in the future events, such as ASL, Spanish, other language interpreters, or Spanish/other language only events? I think this is a really great question for our strategic planning committee to cover. So I'm going to pocket this
We will
one.
take that as great feedback.
It's great feedback.
And we will learn from that feedback and do better.
Yes.
I want to be cognizant that we are past time, and I thank you so much for your patience, for remaining here with us. If we could just please get a hand for all of the speakers today and presenting. So I want to give you these final notes. We are the COC. We are trying to work together to provide the services, to work with our members to provide the services that help folks into a better life. If you're interested, please join us. Take the time to join the COC. We need all the help we can get. And as you can see, we have heroes in this room. We have many. I have to say, I have to mention Dustin Lawson. I know he was here. I don't see him anymore. I don't know where he is. Dustin Lawson started the Lived Experience group for the COC. He is also a person with lived experience, and he is doing great things. We have 3 individuals here who are changing their lives, have changed their lives, and are doing great things. We need all of your help because together we can make change for these people. I'm going to skip to the last part. In this picture, we have a very important COC member who passed. Her name was Holly Hanna. She did great work with our youth, very passionate about working with our youth. And she's one of the folks that I would like to have a moment of silence for. In 2023 and 2024, we lost 14 people and 12 people. That might be reversed, but I think it was 26 total, who lost their lives by living outdoors. That's why this work is important, because it is people and it is life and death for some of them. And so if we could please have a moment of silence for the 26 individuals that we lost and for Holly Hanna. Every day matters. Carissa from Hope Center is putting together a Compassion for the Cold, where we remember those that we've lost in the past year. It is on December 18th at 4 p.m., and it will be at Hope Center. Please join us. It is a powerful event, and it keeps us remembering how important the work that we do is. Thank you for joining us today. Thank you for listening. I hope that we've informed you and inspired you. Thank you.